We are taking a closer look at how the year-long pandemic has taken a toll on the mental health of medical workers. A review of 65 studies from around the world found 1 in 5 healthcare workers have experienced depression, anxiety, PTSD, or a combination of those conditions. The new streaming program, 60 Minutes Plus, shows us one doctor's struggle in Georgia. Here's a preview.
Erin Rayburn Rojas, a critical care doctor at Northeast Georgia Medical Center, says her workload is still more than double what it was pre-pandemic, with no relief in sight.
Have there been moments that have felt like you're reaching a breaking point or have been difficult or where you've been overwhelmed?
Every day.
Every day?
Yeah. It's not uncommon for us to take a minute to go cry. I mean, I cry in my office all the time. Everything you do is about getting people better, and a lot of times it just doesn't happen. The lack of being able to help someone in their most vulnerable moments is the injury. The fact that it happens over and over and over again is what I think really causes the damage.
And you've said that you think about walking away from it sometimes.
Yeah.
How seriously do you consider that?
Depends on the day. As I'm preparing for my shift the night before, I start to get a physical reaction to even thinking about going to work. I start to get palpitations. And then I start to think about, why am I doing this? I don't have to do this. There's been days where I've had to take a personal day just because the thought of coming back in and doing the same thing again was just too much. I don't think it substitutes, what will be needed as far as debriefing and therapy after this.
You definitely plan to go to therapy.
Oh, absolutely. Yeah.
60 Minutes Plus correspondent Wesley Lowery joins us now to talk about this. Wesley, we just heard the doctor say that she thinks about walking away from her job. One of the things that I found remarkable throughout the course of this pandemic, I spoke once to a former medic who had served in Vietnam, and he talked about the trauma, not in the moment, but weeks and months after you come home, how you relive that trauma for months and sometimes, in some cases, years. In speaking to some of these healthcare workers, do they strike you as people who are almost living in a war-like situation where they're dealing with so much trauma, they don't even have time to think about it except when they turn off the lights at home?
Of course. As we've been speaking with healthcare workers, they describe it exactly like that you come into work every day for more than a year, to have your hospital, your emergency room overrun, to deal with folks who are dying left and right of a respiratory illness, where you are often the last person they're communicating with, where it's unclear how you can help them or what you can do. Family members aren't allowed in the room. And this is something that so many healthcare workers have dealt with, not once, not twice, but every single day for an entire year. And so when you talk to clinicians, they talk about PTSD and about a sustained moral injury, that this isn't a singular traumatic event. This isn't one bad day at work, but rather so many of our healthcare workers have dealt with this every single day for an entire year, and that could very well leave them traumatized moving forward.
In listening to that doctor talk, I kept on thinking to myself, what are the long-term implications for the whole mental health industry? Are we going to see, huge groups of people that once this is over with, just decide to walk away from this as a profession? I'm wondering what struck you the most about what these healthcare workers had to say.
Certainly, and I think there is a concern there. We have to remember that nursing had a relative staffing crisis prior to the pandemic. As we emerge from a pandemic, we're going to end up with a lot of people in the healthcare industry who are likely going to step away. And there are calls from some medical associations for us to launch some type of tracking system similar to what we did for 9/11 first responders, to make sure that we're touching base and checking in with all of our frontline medical workers. But for me, as I spoke with so many of these medical workers, it was just story after story after story. And one woman was talking to us about how, for her, she took pride, her entire career, her 2-3 decade career, she took pride in saving her patients. And there was something so heartbreaking that left her feeling so helpless about this pandemic, because most patients who came in, she knew she wasn't going to be able to save.
Wow. You know, Wes, one of the things that I'm curious about and is how these medical professionals, doctors, nurses, clinicians feel when they look at the stark differences in infections and deaths in this country versus what we've seen in some other countries, specifically in the Pacific Rim. And I ask that because it's one thing to find yourself in a situation where you're trying to save lives because of a natural disaster, an earthquake, a hurricane, but it's another when it feels often that some of what has happened could have been prevented, and what that adds to the mental health and stability of these medical professionals when they think to themselves, it didn't have to be this way.
Right. And
Exactly.
Vlad,
You know,
just to
one of the
piggyback on
doctors
what
we
you're saying a little
talked
bit
to-
with Wes,
Okay.
Wes, it's also sort of, and Vlad, it's that steady messaging that you can't trust the medical advice that you're getting. You can't trust the CDC. I mean,
Right.
there was a whole year of here are people who have chosen a very honorable profession, and they are hearing, in some cases, from public officials saying, well, it's not so honorable after all. Sorry for cutting into you, Wes, and jumping on your point, but I think it's a really good point, Vlad.
No, of course, and I was going to co-sign it as well, right? We talked to one physician in Boston who said it felt like Vietnam for this reason, that they felt like they were soldiers on a mission and their government had forgotten them or had taken them for granted. We talked to Dr. Anthony Fauci about this, and he said, yeah, the mixed messages coming from the top that, look, there was no reason America should have been the deadliest country for COVID. But the back and forth, we're going to roll out a phased plan, and then the next day the president says, let's liberate Virginia or liberate Michigan, understandably was confusing for a lot of people. And it resulted in a distrust and a politicization and a polarization of these crucial health issues, where suddenly wearing a mask became a political statement, or not wearing a mask became a political statement, going out to dinner became a political statement, and it did set back our COVID response. And here you have your medical workers who are sitting here every day seeing it up close. We had one nurse told us about how, in fact, it was the doctor who we heard from earlier in this clip, who's telling us about she has intubated patients, right? She is putting them on ventilators, and the last conversations they have are about how, I still don't believe it, it's not COVID, this must be something else. That you have people dying of COVID, they are in the hospital beds, in the ER, about to have their throat pierced so they can breathe, saying, but I still think this is a hoax. And it speaks to the breakdown of trust in our institutions, the extent to which this has been politicized, and it's just a tragedy. It's just a crisis.
Yeah, and the question that we sort of ask often, Vlad, is, can we turn that around? Can we rebuild that trust? How long is it going to take? And, here are people who are beat up and exhausted, and is it really sort of their job to try and turn that around and say, trust us, we know? Part of kind of getting them back and making them whole is getting them the mental health resources that they need. So there's $140 million from this latest COVID relief bill that's supposed to address mental health for healthcare workers. I mean, some things, money, you can throw money at, some things you can't. I think in this case, it's going to be really important to use that money wisely. Do we know how it's going to be used?
So, $140 million in the COVID relief bill. That money is earmarked for doing mental health training and education at hospitals and medical schools, as well as doing public awareness campaigns, because one thing they talk about a lot in the medical profession is this idea that it's very stigmatized. Doctors and nurses have to fill out detailed health history forms for their licenses, and there can be a fear sometimes that if they list that they've gone to therapy or that they're seeking medication for anxiety, they might lose their licenses. It's very stigmatized, right? And so the hope with this money is it's going to retrain doctors and nurses, it's going to go into medical schools, and it's also going to be used for public awareness campaigns, basically to tell doctors and nurses, get the help you need. But the experts we talk to say this is a great start, but the reality is it's going to take a much bigger investment moving forward if what we want to do is make sure that the folks who got us through this pandemic are taken care of on the back end of it.
And finally, Wesley, so, all right, for a year, our healthcare professionals and workers have struggled mightily against the mixed messaging that has come from politicians, to the point that you made, where you've got folks that are being intubated that still don't believe that what is happening or the science behind this infection is real. Now, there's another challenge ahead of us, right? The vaccine, and specifically as it relates to those that have been disproportionately affected by COVID-19. There's a real challenge. And Anne-Marie and I have talked about this before. We've talked about it off camera, but also on camera. This mountain of evidence that suggests that the vaccines are safe, they are effective. When you think to the point that you made, Wes, about the President of the United States saying liberate Michigan, when then we find out just a couple of days ago that, in fact, he, the former president, Donald Trump, he and the First Lady did receive a vaccine in January, and yet they never chose to tell the American people. Why? Because, well, I can't be in his mind, but I can sort of surmise based on the statements that he made over the course of the pandemic. So now you've got people that are suspicious of the vaccine, specifically people in our community, people of color. What are healthcare professionals saying to you about that? They're going to have to climb this other mountain in convincing people, hey, this is the right thing to do if you want to protect yourselves against this infection.
So when we talked to Dr. Fauci, he was adamant. We need people to take this vaccine. The vaccine is safe. And we went back and forth. We volleyed a bit. And I asked him, I said, what do you say to someone who just doesn't trust it, who just doesn't get it? They don't want to put it in their arm yet. And what he said was, he said he thinks we need to do a better job nationally of talking about the process, about how this vaccine came to be. That a lot of people have an understandable skepticism, that typically a vaccine takes a decade to get approved, and suddenly we turned this around in a year. And what he was saying was, it's important to understand that it wasn't that they were cutting corners. It was that they've dealt with similar viruses before, so they had a jump start, right? That they were able to remove some of the red tape that might typically catch something up. And so the fact that we have a vaccine so quickly does not mean this can't be trusted or can't be used. Rather, it's a medical achievement that we were able to, in a time of crisis, move as quickly as we were. But secondarily, when we talk to the nurses and the doctors who are in these clinical care units, who are in these emergency rooms, they are begging people to go take vaccines. They're horrified for what happens this summer if people are not vaccinated, if we don't get to herd immunity. Because what happens and what has happened each holiday season during this pandemic, as people go see their families, go on vacations, is that there are surges in COVID patients, and it means that our nurses and our doctors are having to deal with an increased workload, and they're having to see more people die.
Man, Wesley Lowery, thank you so much. It's a great story to tell. Often, you know, these are our heroes, but our heroes are hurting, and it's time for us to support them. So thank you.
Thank you.
So listen, if you or someone you know is seeking mental health resources, you can call the National Alliance on Mental Illness Helpline. It is 1-800-950-6264. Or in a crisis, text NAMI to 741741.